We know this virus hasn't left, and it is circulating in our community, and that's why we're doing this so cautiously and thoughtfully. And if we look at the modeling of what we've seen in other places and what we've seen here in BC, there is a potential for it to start transmitting quite rapidly in our community. We've seen that in other places where you get rapid increases in numbers of people who are infected in a short period of time. Right now, a case in point is in South Korea, where there's been quite a lot of transmission from somebody who inadvertently went to a number of nightclubs and spread it to a variety of people, a couple hundreds, maybe even thousands. So those are the types of situations we want to avoid right now. What I'm talking about longer term is there is some seasonality to respiratory viruses historically, particularly with influenza. We know that influenza fades away in March, usually, or sometimes April here in the Northern Hemisphere, and we tend to have very low levels or very little influenza during the summer, but we know it comes back in the following fall. And we know that that is the pattern that we see with other coronaviruses. So chances are we are going to see that with this coronavirus as well. So even if we're able to control it well during the summer, the chances are that just the climatic conditions will naturally allow it to increase in prevalence during the fall. I mean, I would really like to think that's not going to happen, but if we look historically at all of the pandemics that we have historical data about, that is what has happened. And sometimes we've seen a bigger wave in the second wave, sometimes it's been smaller, so we don't know what that's going to look like, but we need to watch very carefully to see. I know, though, I can say with some certainty that we are going to have respiratory illnesses in the fall, and we're going to have influenza, we're going to have RSV, we're going to have parainfluenza, we're going to have other things that are causing people to get sick with very similar symptoms to COVID. So we need to be prepared to be able to test for those, to test for COVID, to be able to determine which are which. And so that's why I think it's so important for us to maintain the lid on the numbers of cases that we're seeing through the summer, so that we're not starting off with a lot of spread in our community, and we've seen that in some other places around the world, but also to have the testing and the contact tracing and all of those things that we know are important to have in place come the fall, so we're able to manage this and that we're able to manage it without overwhelming our healthcare system.